our research impact. And I'm delivering this as someone who's co-lead for our REF 2029 Unit of Assessment 3, and I'll explain what that is for anybody who isn't familiar with REF. And also because I developed one of our impact case studies that was submitted to our university's REF 2021 submission, and I'll explain a bit more about what that is too. So what I'm going to cover today is just an introduction to what we mean by research impact, so that you can get a sense of why this is important for you and for your research, how to begin to consider the potential impact of your research, what is a research impact case study, and a little bit about REF and 2029 and research impact and what that maybe is going to look like in future. So impact, very, very simply, is the good that researchers can do in the world. And Professor Reid has been doing a lot of work in the UK around research impact. I've put a reference to his textbook, which is a handbook about research impact. York St John has brought him several times to the university to deliver training on research impact for staff. If they do that again and you see that he is here and you're free, I would really recommend going to his training event. So when I knew that I might be involved in developing a research impact for REF, I got to go to one of his workshops and it was incredibly helpful for me. And I found his book and I've put the reference at the bottom of my slides for you, really useful. He also has a website and he also has like an updated newsletter, which I follow. So I really commend the website, the newsletter and his book to you. So other definitions of research impact, and this one comes from the Economic and Social Research Council, is the demonstrable contribution that excellent research makes to society and the economy. And from ESRC's point of view, they talk about dividing impact into academic impact, which is the contribution that research makes in shifting understanding and advancing scientific method, theory, and application across and within disciplines. And then because the Economic and Social Research Council are very focused on economic and societal impacts, they then define that as the demonstrable contribution that excellent research makes to society, the economy, and its benefits that can be from an individual level, an organizational level, or a national or even an international level. So I've mentioned REF a few times already. So what is REF, if you're not familiar with it? REF stands for Research Excellence Framework. And in the United Kingdom, it's a system for assessing the excellence of research in all UK's higher educational institutions. So we have to be involved with this as an HEI at York St John. So these REF outcomes, so the ratings that we get from our REF submission are then used to inform the allocation of approximately £2 billion per year of public funding for universities' research. So that's why our ratings and how well we do in the REF is really important for our research at York St John, because that's where our QR funding comes from. So when in the school, you see Daniel Madigan is our school research lead in the School of Science, Technology and Health. And I think he sent round a recent email this week just reminding people that within the school, we've got a deadline, I think in January, I've got it in my diary somewhere, where staff can apply for QR funding. And so this is where the QR funding comes from. There are also central pots of QR funding in the university, which have helped support the development of our institutes for, we've got the Institute for Social Justice and the Institute for Health and Care Improvement. And there is an internal kind of university-wide pot that people can apply to that funds work that supports impact and the evaluation of impact. So REF uses a process of expert review. They have some main panels, one of which is called Panel A, which we come under, and then they have sub-panels underneath those that have numbers. So when we talk about UOA 3, we're talking about our unit of assessment that we submitted to. So the panels are made up of senior academics, international members, and research users, and they review and judge the submissions that each of the universities make. So REF's purpose is to provide accountability then for the public investment in research and to look at the evidence of the benefits of this investment. So impact and evaluating impact is all about looking at not just what research we've done and what outputs we've produced, but whether that research actually had a benefit, whether it actually made a difference. So it gives benchmarking information across the higher education sector, and that information is also available to the public. And it informs the selective allocation then of funding for research. So for us as a university, it's really important. So REF submissions are based around disciplines. Now, this is one of Owen's slides that I've pinched for anybody that wasn't able to come to his session. So we're divided into 34 units of assessment. York St John doesn't submit to all of those units because it depends on what subject areas that you have in your university. And at York St John, for those units that we submitted in REF 2021, or we think we might submit in the next REF, which will be now in 2029, when we have to submit to it again, we all come together in a subcommittee of the research committee, which is called the REF subcommittee, and we meet several times a year to look at how we're working towards the next REF submission. So UA3, which is the unit that we're involved with, is for allied health professions, dentistry, nursing, pharmacy, nutrition, and biosciences. So when we submitted in 2021, that included occupational therapy, physiotherapy, all our other wider health colleagues in the school, and also biomedical sciences. And we also have colleagues from counselling from another school who are part of our UA3. Since that submission, we've got nursing programs that have been here for several years. We've got paramedical science. So we're anticipating that our submission will grow for 2029 because we've got more staff coming from different health backgrounds. Within our school, colleagues in sport have a different UA, I think it's UA 24, so they actually submitted to a different unit of assessment to us. So we have co-leads for UA3 for the next submission, and they include myself, Professor Lynn Gabriel, who will also be providing in the new year another one of these training sessions related to REF. And then Owen, who delivered the session on demystifying REF recently last month. So our REF submission for 2021 then for UA3 involved a full-time equivalent of 17.4 staff, and they were staff who, under the code of practice that York St John had to develop related to the REF criteria, were seen to have significant responsibility for research. So the staff sort of submitted out of all the kind of staff in health contributing to those kind of programs was 55%. So our research outputs in UA3, they were all peer-reviewed publications that we put forward. And the results we got, you get ratings which are to do with star ratings. And I'm going to explain that a bit more in terms of what that looked like for impact. But our result was we got 5% 4-star, 3%, 35% 3-star, 49% 2-star, and 1% and 11% 1-star, and we didn't get any unclassified ratings, which was fantastic. So our aim for REF 2029 is to try and build on that and achieve more 3- and 4-star ratings next time. For our research impact, based on the full-time equivalent staff that we had to submit 2 impact case studies, and these are 5 pages long, and I've uploaded in the chat the one that I led. And our result was we had 75% was rated at 2-star and 1% was rated at 25% was rated at 1-star. And then we also had to write a research environment statement, which was an 8,000-word statement about how our department and our unit conducts and supports research and impact. And that includes our PGR students and enrollments and completions, research funding. And our result for our research environment was 37.5% was rated at 3-star, 37.5% at 2-star, and 25% at 1-star. So what I'm really going to focus on now is just the research impact element. So REF uses the Higher Education Funding Council for England's definition of impact. So REF looks at impact being the effect on, change or benefit to the economy, society, culture, public policy or services, health, the environment or quality of life beyond academia. So in that earlier definition from ERSC, they talked about there being an academic impact and then there being an impact that's kind of beyond academia. So we're very much looking at that impact that we have beyond academia. So it's not just about how many times has a peer-reviewed article been cited by other people, and you know, what's the impact factor of a journal that you're published in. It's much wider than that. So for REF, impact includes but isn't limited to an effect on, a change or a benefit to these things: the activity, attitude, awareness, behavior, capacity, opportunity, performance, policy, practice, process, or understanding of an audience, beneficiary, community, constituency, organization, or individuals in any geographic location, whether that's locally, regionally, nationally, or internationally. And this is how the star rating criteria were used for REF 2021. So when I was saying earlier, you know, we got so many percent 4-star, so many percent 3-star. For REF 2021, 4-star meant outstanding impacts in terms of their reach and their significance. 3-star was very considerable impacts in terms of their reach and significance. 2-star, and we got 75% 2-star, was considerable impacts in terms of their reach and significance. 1-star was recognized but modest impacts. And then unclassified, which we didn't get, was the impact of little or no reach or significance, or the impact wasn't eligible, or the impact wasn't underpinned by excellent research produced and submitted by the unit. So how is the quality of research judged? These are definitions from the Research Excellence Framework document that was produced to inform our submission for REF 2021. So it talked about originality, so the extent to which an output makes an important and innovative contribution to understanding and knowledge in the field. They define significance as the extent to which the work has influenced or has the capacity to influence knowledge and scholarly thought or the development and understanding of policy and practice. They talked about rigor, so that was the extent to which the work demonstrates intellectual coherence and integrity and adopts robust and appropriate concepts, analyses, theories, and methodologies. And then impact, which I've already given you the definition of. So significance then and reach were the things that we were really needing to demonstrate and evidence and evaluate for our impact case studies. So these were the things that we were really focused on establishing and evidencing in the impact case study. So types of impact that your research might have is specific to each project. So you need to think about your own project, and impact can be really wide ranging and it can be really varied. So some of the key areas of research impact that you might be thinking about whether your research would have an impact on include a cultural impact, an economic impact, an environment impact, a social impact, an impact on health and well-being. And for us in UA3, this is one of the most sort of significant impacts that we are looking at. And our other impact case study was led by Lynn Gabriel, and was based on all the work that was being done in the communities centre. So that very much was focused on health and well-being impacts. Impact around policy influence and change, could have a legal impact, it could be a technological development. So when you're thinking about the types of impact your research might have, think about all these different things and where you're focusing on the benefits of your research. So in order to achieve impact, we need to have different pathways to impact. And this figure comes from the Research Council's UK. Unfortunately, it hasn't come across very clear on the slide, but hopefully you can read it. But it's talking about all the different things that we might be doing in order to lead to impacts. And I'm going to share with you some of the pathways I've used to trying to create and evaluate impact for my own research. So in health, the NHS kind of improvement model uses a kind of plan, do, study, act, or a plan, do, study, review cycle. And the Code of Good Practice Impact from the NCVO, which I've given you a link to, they use that same process kind of improvement model, and they identify 4 main areas of activity that make up impact practice. So these are the things that as researchers we need to do. So the first thing is planning, and I came to this at a stage where I was undertaking the research already and then having to think about evaluating the impact afterwards. But now moving forward after that experience, as I'm working on each research project, I start thinking about impact right from the beginning of the project. So when I'm working on a proposal, grant application, working on any new piece of research, we start thinking right from the start, what is going to be our desired impact and how can we deliver that impact? And also start to think about how might we measure that impact? How will we know whether our research has created the benefits that we're hoping it achieves? So that's the planning stage. At the do stage, once we've created our research, we've done our research project, we've got our outputs, whether that's a conference presentation, whether that might be some kind of toolkit or resource. In my case, it was the development of some standardized assessments. So I'd got manuals, scoring forms, instruction cards for how to do the assessment. So those were my outputs. Once you've got that, then you have to spread the work and have pathways to disseminate the work and then collect the information you need about the impact. So I found that doing the study, it was almost like you do a follow-up study to your main piece of research, which is an evaluation project to collect the evidence of the impact. So that's the do phrase. In the assess phase, you're making sense of the information that you've collected about the impact and you're drawing conclusions about the impact that you've had. And then finally, the review is about communicating your impact, learning from your findings and using them to improve your work. And I found this really valuable for my research because it's made me think even more about How do I deliver training about the assessments? What other things would it be really good to work on in the future to improve the kind of reach of the assessment? So one of the things that I'm looking at is, I think it'd be really good to develop some training videos for the assessments. And also I've been talking to Rob Mortimer and some other colleagues at the university who have developed bespoke websites to promote research impacts. And that's one of my next goals, is to look at applying for some of the internal pot QR funding for impact, and setting up a website that will disseminate the two assessments better. So at the moment, there's just a small amount about the assessments on our health, wellbeing and participation website, and we want to really make them more visible. So fast track impact is one of the things that Professor Reed, who I mentioned at the beginning, leads on. And this is a poster that's about impact, but I liked it because it starts with like 5 top tips. So if you're just beginning to think about research impact, these are some really useful places to start. So work out as early as possible who might be interested in your research and who you think might benefit from it. So really think about that during your development proposal stage. If you can't think of anyone, then get some mentorship and support from other people who have got some experience thinking about impacts. If you've got limited time, prioritize the most important organizations and groups. For example, those that might be highly influential or particularly vulnerable or particularly hard to reach, that you want to get your research findings out to. It's really important to start with the needs of the people that you're trying to improve the lives of through your research. So reach out to those you've prioritized, explaining to them how your work might address their interests, how your work might benefit them. Meet them in a listening mode. So you're putting yourself in their shoes. You're trying to understand how they see the world. In my case, I was particularly working with occupational therapy clinicians. Work with them to make an impact plan that delivers clear benefits with tailored activities to help put things into action. And in my case, that was, we had delivered some CPD training on the two assessments centrally at York St John as part of the health CPD plan. But what was more useful for the trust was me going out into the trusts and delivering bespoke training to their occupational therapy staff in the trust. So one of my pathways for impact was getting out into different trusts in the NHS and delivering training. And I'm still doing that. So we're spreading further. This summer, I've been over to Hull, and I've delivered some more training on both assessments in Hull. You then need to keep them engaged, so you need to deliver quick wins. So if you've got something like a literature review, or if you've got you've done a peer-reviewed article, also have like maybe a lay summary of your findings, or a leaflet about your findings, a poster about your findings, or some kind of much more accessible ways of disseminating your research. Regularly get feedback on how the research is progressing and the priorities of your stakeholders. So I'm going to share with you in a little bit the types of things I did to get that feedback. You might co-design and produce events with people. So one particularly strong impact to make is when things start to influence policy development. Learn about what works. So create a space where you and other team members can keep evidence of impact. So that was one of the things that I hadn't done as much before. People would ask for copies of the SOTOF, which is now published under a Creative Commons license. And I wasn't kind of keeping track over who necessarily, I was just responding to those. So now whenever I send a copy out, I've got a folder in my emails and I keep a note of who requested it and who I sent it to. But I also invite people to provide their contact details and be part of a database so that I can go back to them afterwards. So not everybody signs up to that, but it does now give me a database of people who've given me permission under GDPR to go back to them again and get feedback from them. Um, so the other thing it says is just remember why we're a researcher. You know, particularly in year A3, we're very interested in people's health and well-being. And we've come into our areas of research. Often, quite a few of us have got clinical backgrounds. So keep remembering what your kind of end goal is and why you're doing the research, why it's important, why you feel passionate about it, why it really could make a difference to other people. So I mentioned right at the start that I'd put up some materials for Victor. So for those of us who are working in health, I think this is a really useful tool. It consists of a questionnaire that's designed to provide a guiding framework within a structured interview or as a self-completed questionnaire to gather impacts from researchers, research participants, managers, and clinical teams. So its 6 domains of impact include health benefits to participants, service and workforce changes, research profile and capacity, economic benefit, organizational influence, knowledge production and exchange. It was developed in a partnership between the NIHR, 12 NHS trusts, and one of the clinical networks that was in sort of Yorkshire and Hull, I think. So it's freely available to download from the link that I've provided here. You have to complete just like an online form with a little bit of information in order to download the materials. I haven't used this yet, but it is well evidenced. A lot of good quality work went into developing it. And I think particularly where I'm looking at potential impacts of my work in NHS settings, it could be a really useful tool. Other things for us to really think about as researchers in terms of pathways to impact is open access. So open access is really important for REF. REF say that an output to have an output that could be counted for REF and submitted to our next REF, it must be uploaded onto York St John's Research at York St John's site, which is RAY. It's our open access site, as soon as it's accepted for publication. So not at the point of publication, but as soon as you get that email from a journal that says you're accepted for publication, please get in touch with staff. So there is an email that's just Ray at York St John, and you can email them with the details of your journal output. Now, if it isn't an open access journal, they'll be able to find out what version you are allowed to upload onto Ray. So for quite a few of the journals that I've published in, it's been the accepted Word document manuscript that we're able to upload onto Ray. But this is one way that people will find out about your research, so it's really important. Another thing that's important for you to have is to have an ORCID registration identifier. It's like a sort of long number that you have. And that distinguishes you from every other researcher, particularly if there are other researchers that have the same name. So, and different journals will sometimes put your name in different formats. So some journals will include your initials, for example, and some don't. So it's really important, and I found it was really important because I didn't always hyphenate my two names, and so I've got some citations under Laver and some under Fawcett. So having the ORCID linked to my publications really helps me track who's citing my work, and the reach of my work. So for our next REF 2029, we're going to have an introduction of an impact narrative, which is going to be worth at least 5% of our overall unit score. And this is to assess and recognise and reward approaches to maximising the impact of our research. There's a webinar that's about an hour's long that's available on YouTube that explains more about this for anyone who's interested. And they talk about assessing the rigor of our engagement with the people and the organizations who might be benefiting from our research. And they're going to be drawing on NCCPE's 10 Principles of High Quality Engagement. They also have a REF 2029 also has a frequently asked questions page. So I've given you the link to that because that's really useful. Professor Mark Reed has a blog, and he's blogged on this just a few days ago in December on what is good practice engagement and impact. And they're starting to create some guidelines for us as individual researchers and also for institutions. So that blog doesn't take very long to read, and it's really useful. So I just mentioned the 10 principles of high quality engagement. We haven't got a lot of time today, so I've put them on the slides, but I'm not going to sort of talk through them verbatim, but I've got them there for you as a resource, and I've also put the website in there for you. I want to talk a bit more now about REF impact case studies and how do you build the evidence for your own research. So this is a link to some example case studies on the REF website. And I'd really encourage you to have a look at these, not just the one that I put up, because our REF impact case studies, we got a 2 and a 1-star rating. So it's really important not just to draw on what I'm sharing with you, but also to look at other examples of 3-star and 4-star kind of higher rating, higher impact case studies. So the case study that I led was about improving occupational therapy assessment through the implementation of 2 standardized assessments in clinical practice. And the 2 assessments were called the Structured Observational Test of Function and the Activity Card Sort UK version. So the first thing I wanted to share with you were examples of how I disseminated the work and what we call the pathways to impact that I created. So the obvious first one is publications, and I made sure that those were open access on RAY so that people could access them through the journals they were published in, but also through our York St John Open Access repository. I also tweeted about my work, so I used Twitter, now X. I had workshops that I delivered on each assessment at the university as part of our health CPD portfolio. I delivered more workshops on request of NHS trusts, took the opportunity to attend various conferences. So I disseminated the work through national and European conferences. And then I made sure that I uploaded my PowerPoint presentation onto Ray. And also I have a ResearchGate profile. So a lot of people have learned about ACS and SOTOF through ResearchGate. And I got another request from someone from another trust in the UK just this week asking for a copy of SOTOF. And she mentioned that she'd looked at this particular presentation on ResearchGate, and that's how she found out about it. I was also invited to do a presentation on the ACS at the Occupational Therapy OT show, so I took that opportunity. And when I was at the European Network of OTs and Higher Education Conference in Athens, they have stands which you can apply to have a stand where people are having lunch and where they're having coffee and tea. So I had a stand that I manned in each of the breaks that was about the ACS and SOTOF. Through spreading the word, I've then been invited to teach about SOTOF. In Austria. I've also talked about it and talked more widely about assessment and my assessment book in Belgium as well. And when I visited the Centre for the Rehabilitation for the Paralysed in Bangladesh, and I was there to do halfway visits for OT and physio students, they also asked me to do some teaching on their masters over there, and I offered the staff a session on the SOTOF, which they were really interested in. So it's thinking about, well, I'm going and meeting with this group of therapists for this reason, so placements, but can I see if there are opportunities to share the work while I'm there? So it's being opportunistic. I found Twitter's been one of the most successful strategies for disseminating the work. So, for example, just one tweet that I posted led to 52 requests then for copies of the SOTOF from OTs and from students, not just in the UK, but also from Turkey, USA, Philippines, Australia. And also through other tweets and other messages I've posted, I've had requests from OTs in Singapore, New Zealand, Lithuania, Poland, Canada. I found our OT students can be really helpful ambassadors for the two assessments. So they've introduced the SOTOF or ACS while they've been on practice placements, and that's led to clinicians requesting the assessments. So I've lent the assessments to students while they've been on placement. Often the students have then delivered a presentation about the assessments, and I've supported the students developing those presentations. I mentioned earlier that I created two databases now, one for each assessment. So when people receive a copy of the SOTOF or they purchase or request information on the ACS, which has to be paid for because it comes in a kit, they're invited to join the relevant database. So I use that to keep colleagues updated about the assessment developments, but also it means that I can contact them. For example, one of the things I'm planning to do for the next ref for growing the impact case study is to do an online survey to contacts in each database to ask them, whether they're using the assessment, how they're using it, and to seek some information as to, whether they perceive any benefits from the assessment in their practice. So I'm not going to go through all these slides in a lot of detail because in them are some quotes and things that you can also read in the impact case study, but I want to give you some more ideas about how I actually evaluated the impact of the assessments. So one of the ways I did that was through working in two NHS trusts. So I applied for our university QR funding for an impact evaluation where in two trusts where I delivered training on the SOTOF and the activity card sort. I used that money to employ two research assistants. Because I delivered the training, it was really important that it wasn't me that was then getting feedback from people because of the risk of bias. I really wanted people to be able to give really open and honest feedback. So we achieved that by using two research assistants, having an anonymized online survey that was distributed in both trusts, but also those research assistants did an in-depth semi-structured interview with an OT that was leading the implementation in one trust. And we had a pseudo-anonymized focus group with OTs in another trust. And they then did the descriptive and content analysis of the surveys and the initial thematic analysis of the qualitative data. One of the OTs who led the implementation in the trust then provided a testimonial letter for the impact case study. So you can provide evidence for an impact case study in the form of testimonials, so letters and emails from people who can give evidence about the impact of your research. And another thing I did was a review of wider literature that was citing the two assessments. So that helped inform it too. So the next few slides, which I'm not going to go through in detail, show examples of quotes that came out of that evaluation work, that we were then able to weave direct quotes into the impact case study that went to REF. So having direct quotes from people who are using your research or benefiting your research is really helpful because it's not just your voice as a researcher. So I've got quite a few examples here of quotes that were used to kind of show how the assessment could improve clinical practice or could improve the quality of the assessment for the patient. The other thing I used was I was requested a copy of the ACS by a randomized controlled trial. It was an NIHR randomized controlled trial called Valuing Active Life in Dementia. And so I got a testimonial letter from the OT lead clinical researcher there. it was requested because some of the people with dementia struggled with the interview process that was being used at the beginning of the intervention. And they felt that the activity card sort, because it contained photographs of activities, it served as a memory prompt. So this is an example quote that came from that testimonial letter. The review of the literature, this is an example that was woven into the impact case study. So it was an article from 2020 that was an audit of dressing practice by occupational therapists in acute stroke settings. And in that, it talked about one of the assessments, the SOTOF, was one of only 5 standardized assessments being used, and it was the third most frequently being used in practice. Following the teaching I'd done in Belgium, I then got approached by a hospital in Belgium. They wanted to translate part of the SOTOF into Dutch. They had a master's project around that. And then they evaluated its use with 10 patients with neurological conditions. So I had a testimonial letter from the occupational therapist and the head of occupational therapy there, and they identified SOTOF strengths. So that was woven into the impact case study, and some quotes from the testimonial letter were also woven in. Another example I gave in the impact case study was the SOTOF was being used in other universities in occupational therapy education. So a senior lecturer from St George's University in London, she wrote a testimonial letter as part of the impact case study. And quotes from that letter were also woven in terms of how it had been used with students. So it's thinking about where you can get people to corroborate that your research is making a difference. I have to say that asking people to write testimonial letters was the bit I found hardest through the whole process, and I felt least comfortable with, particularly when I was asking like really busy clinicians in the NHS. And this was during kind of COVID time that we were preparing this, to spend time writing me a letter. So I think that was the hardest thing, was to kind of develop the wording to ask people. But I was, really surprised that people said yes, and they were really happy and willing to write these testimonial letters. Another piece of evidence we used was a Masters by Research study that was conducted in an NHS trust by one of our undergraduate OT students, who then went on to do a Masters by Research. And that was really useful because it involved interviews with patients about their experience of using the test. It also involved a survey of occupational therapists and a focus group with a multidisciplinary team. And so I won't go through all these quotes, but these are examples of things that came out of that Masters by Research thesis that we were then able to use in the impact case study as well, from the patient perspective, the therapist perspective, and the MDT. So in the last kind of 10 minutes, the message is really for you to take away would be to start thinking about who's going to benefit from your research project. And I know, some of you, I know your work. So I know, for example, Fiona, who's here, who's just finished her PhD. She has research that really benefits people who are asylum seekers and refugees, but also her PhD looked at the benefits for occupational therapy students in being involved with the student as co-research projects that related to that research with that population. So, for example, from Fiona's research, there are 2 beneficiaries. There are the research participants themselves and the learning that comes from that can inform how occupational therapists work with refugees and asylum seekers, but also there was the benefit to the learning and the experience and shaping kind of attitudes and values of OT students. So you want to think about then who might benefit from your research and why they might benefit, and what types of impact might your research project lead to. So those are really important kind of questions to reflect on. How could you then ensure those potential benefits happen? So it's not enough for us just to get a research output, publish it in a journal. You've then got to think about, how can I let people know about that journal article? Or in my case, how can I let people know about my outputs, these 2 assessments and the materials? So think about pathways to impact. That could be a blog, it could be a tweet, it could be disseminating in conferences. So I've given you quite a range of different pathways to impact that I use for my case study. Then think about, how can you evaluate the impact of your research? So some of the ways I did that was through survey, through interview, through focus groups. And if you need money for those, then there is that pot of money centrally in the university that you can apply to fund that. And then, how can you communicate the findings of your research to potential users who might benefit from the findings? So really think about how you're planning to share your results, and start with the participants who've been involved in your study. So one of the ways we can do that is by creating something called a So What summary. Um, and your So What summary should contain enough essential information that hook people in to your research and why your research is valuable and important. They're really short, so 800 words, about 2 sides of A4, so people can read it in like 5 minutes or less. And it includes details of your research process and findings, and it clearly signposts with links to available reports. So you could signpost to things uploaded onto Ray, for example. And you use graphics and visuals wherever possible. So there is this website called Social Care Research Impact.org, and it has a number of impact tools, one of which gives you more details about creating a research summary. And then finally, because I know we've only got about 5 minutes left, I've just put a reference to the Research Impact Handbook by Professor Reed, which I really recommend, a link to the Social Care Research Impact website. So that has quite a few tools and methods, and the So What summary is just one example of those. And then there's also a link which is more about measuring your own research impact, your own author impact. That's more focused on getting to understand and know your own academic impact and the reach of your research in terms of citations. Until I was applying to for promotion to associate professor, I really wasn't spending a lot of time thinking about that. And actually, I remember spending half a day just looking at citations, looking at where the work had been cited, particularly one of my textbooks. Um, and actually, it was a really validating thing to do, because I just hadn't realized where it had been cited, who'd cited it. And so one of the things to also start keeping a better track of, to help you assess your own outputs, which is something that Lynn's going to talk about more in the third of our staff sessions. So I've also given you a link to that. So thanks, Owen. Could you stop the recording now?